We have a very long-awaited event this evening, the Queer Sex and Pleasure creating a discourse event. I think some people were asking the question, sort of, what is a discourse? Or, what does that even mean? How do I create that? And what I'm saying is that I'm hoping that we have some disagreeing tonight, is what I'm saying, because I think that agreeing is great, but I think that disagreeing sometimes offers us a bit more learning. And so I hope that that's really clear to our guests and to those who will be joining us this evening. I just want to introduce myself. My name is Harvey Kennedy. I'm the CEO of Black Beetle Health. I'm a scientist, I'm a public health practitioner, and I work both in the community and in the more formal statutory sort of sector in the NHS. And the point of tonight's event was really to try and bring together the best of the minds I could think of from across all different types of specialties and really try to understand the pleasure narrative. Okay, so what people are saying about the pleasure narrative, how they understand the pleasure narrative, where does it come from, where has it gone, for goodness sakes, because we don't really know what's happened to it sometimes, and how we can take sort of an uninformed approach to understanding it better, really. So I'm just going to go around my screen really quickly and just ask our lovely guests to introduce themselves. So we have sort of Zaina at the top of my screen, and I'll just go across one by one. Zaina.
Good evening, everybody. My name is Zaina Ratti, and I'm an LGBTQA plus hypnopsychotherapist based out in the sticks up here in Oxford. I'm also a Stonewall role model, Pink Therapy endorsed GSRD awareness trainer, and I'm also chair of Oxford Pride.
Amazing, thank you so much, Zaina. I'm going to go right along to Dr. Kiosha Bond.
Hello, everyone. My name is Dr. Kiosha Bond, and I am an assistant medical professor in community health and social medicine in the City University of New York School of Medicine, and I'm from New York City in the United States. And I'm also an HIV sexual health researcher who focuses my work on looking at the sexual and reproductive health needs of marginalized genders, and that includes for my work particularly cisgender and transgender women.
I hope you got all that. That was good, right? Okay, I get excited every time. Okay, India, over to you.
Hello everyone, my name's India Henry and I work for BHA for Equality, and I'm here in Manchester, and I am sexual health advisor and asset-based community development lead. So we basically go into the BAME community and we empower people to feel confident about their sexual health needs, and also we work as part of HIV prevention.
Amazing, amazing. Okay, so for those of us who are joining us who might not understand what BAME is or BAME, so that's going to be Black, Asian, and other minoritized ethnic individuals. So you can take that or leave that, but that's how we understand that. Okay, over to you, Shireen.
Hello, everyone. My name is Shireen Saunders. I actually am a manager in a research lab at the University of Miami. And some of the work that our lab does centers around racial, ethnic minority groups, as well as gender minority groups. And we do a lot of community work as well, including PrEP and STD and HIV testing. Yeah, that's about me for now.
I'm sure you think of the rest of it as we progress this evening. Dr. Baxter, would you like to introduce yourself, please?
I am Dr. Sebastian Baxter, pronouns he, him. I have a background in visual anthropology, artistic film, a PhD in art and design, and I work in sexual health. But I'm here today representing a transgressive artistic space called queer space called Manchester Penetrate, which is realised through performances in different sort of arts and academic spaces, and mostly online through many multidisciplinary artistic representations. So poetry and performance and distorted imagery, agit porn video. And lots of different types of prose, so lots of polemical prose. I write a lot about my queer influences and sort of avant-garde text. And my areas of interest are urbanism, queer identities, love, addiction, cruising, and chemsex. And the last two I'll probably speak about a bit more later in the broadcast.
Do you mean there's more than that? Oh, it's amazing, it's amazing, it's amazing. And then last but not least, we have Phil Samba.
Hello, everyone. Hello, everyone. My name is Phil Samba. 4 days a week, I work at Prepster, an organization designed to educate and agitate for PrEP access in the UK and worldwide. And 1 day a week, I do research on self-testing at the London School of Hygiene and Tropical Medicine.
And this is why I have these guests in this space, because it's so much amazingness already. So I just want to thank all of you for being here, and I'm going to launch right into the questions. So I just want to encourage those who are attending, feel free to jump in the chats, and ask questions or give comments, and just keep that going. And I'll try my best to keep track of that and take notes of those and include those in the conversation and dialogue as well. My sort of first question is going to go straight back to Phil. I just want to try and understand what factors you think are really dictating the pleasure narrative, or how people view and understand pleasure in this context of sexual health and sexual practice, both personal, okay, and sometimes how we direct people professionally, and how that might be received by sort of Black African and Afro-Caribbean communities in the UK. Big question, but I know you know what I'm talking about. Go for it.
Okay. Okay. So, sorry, I think someone's trying to call me. I don't know why. So first of all, I feel like the kind of aspect of pleasure is usually missing from sexual health. Like, sexual health is always deemed as this thing that is I don't even think it's deemed that. I think that there's this annotation that taking care of your sexual health is is something that's wrong or something that's bad. So, like, for example, if I guess it's different with us working in the field, but like, I know that generally amongst a lot of Black Africans and in queer communities, that if you have conversations about getting tested, then it's like, why? What's wrong? And why is that part of the conversation? Why is it not like, I want to get tested to make sure that I'm clear of STIs so I can have the best sex that I can have? You know what I mean? And I don't necessarily think it's the institutions or the organizations that we work with, but I think there's a general kind of consensus about what sexual health is and why it should be done. I don't know if that answers the question or not.
Absolutely. I think we can go a step further, and if anyone else wants to jump in there and just really tackle the Black African, Afro-Caribbean, African American, even, we have some representation here as well. Why don't we want to talk about this? Why is pleasure removed from that narrative? What is the logic? What is the discourse behind that?
I think within the families or within the culture, I mean, a lot of times the whole sex talk is a shot away from topic, and I think that spills over as well. And if you're not comfortable talking with your parents about that, or if you're made to feel ashamed or feel that it's a dirty thing you kind of do and at nighttime or whatever, then it's kind of hard to bring it to the forefront or have it out in the open, or have those kind of discussions. Like you said, it's about health or taking care of yourself, because everything is kind of like, well, we do that at night, or it's in the corner. Like you said, if you're not accustomed to getting tested regularly, or it's not a part of like your pap smear or whatever else you're doing for yourself, you're thinking that's other, that's not, my mainstream health or my regular, everyday checkups.
Amazing. Absolutely.
Yeah. Sorry, I was going to say that I also think it comes from a lot of from racism and discrimination that we face, and the stereotypes that Black people of all and the whole African diaspora actually face. And and some of our objections or shame comes from the idea of respectability politics, really, in the idea that we need to look a certain way and act a certain way in order for us to be acceptable in society. And because of that, a lot of times, it is it does affect our sexuality and how we view sexuality in its course. And those are the scripts that we get, because it's not just the sexual scripts we get from our parents, but the sexual scripts we get about ourselves from how we see ourselves in the media. And and now that includes social media. So that means that our young people are getting exposed to it at a very early age, really. And so I think that is part of it. It's like all of the cultural norms surrounding sex. And then on top of that, we're, that's under the umbrella. If you are a person of color in this society, in a Western society, you are facing and dealing with racism. Is taking over it. And so I think that's where some of our issues with pleasure comes into play, really, and when we can have pleasure, actually.
Well, that being said, I want to jump across to sort of Dr. Baxter and ask, if you feel, that with all that being said now, that sort of sexual health and well-being and pleasure and all these things have become too centralized to that queer identity. Are we talking about this too much? It always just seems to come back to sex. I don't know if that's just me that feels that sometimes.
Well, I think in terms of queerness, a focus on pleasure and well-being can never be too central. I think particularly when talking about well-being, a reason why we queer people may need to focus on well-being more than straight communities is that historically and presently, we tend to have poorer healthcare outcomes than straight communities. So I think that might be the reason why that is a focus so much of our conversation and discourse. I think in terms of sexual health, you're dealing with something different. I think for certain sections of queer community, sexual health, they've been excluded almost from the sexual health narrative. And sexual health seems to focus, what's too central, I think, is the notion of risk. And a focus probably too heavily on gay, bi, and other men who fuck men. Sorry, I hate the term men who sex with men. I have to use it professionally, but in an artistic sense, I prefer the term men who fuck men. There might be a sort of like historical reason for this. This sort of like HIV, the history of HIV comes into play. Definitely in the last few years, chemsex, which is an area that I'm very interested in and look at quite deeply in my work. And I come at chemsex from a number of different insights. So, there'll be my professional experience working in sexual health, research experience, but also in experiential knowledge. So I'm very open about the fact that I engage in chemsex, and I'm open about my addictions and so forth. And use the doctor in my artistic title very consciously, because I think there's a narrative was built up that chemsex is, people who engage in chemsex are these sort of, desperate and depraved and, sort of unrestrained, incapable human beings that need our help and intervention.
Okay. So this is exactly why I invited you to come on here, Dr. Baxter, because I know you're very open about that, and I think it might be very easy for you to put that at the center of your experience. But we're looking at sort of communities of color as an example. Yeah. Would that be the same thing? Because my impression in my head many years ago was that things like chemsex were not a black thing. It was not an Afro-Caribbean thing. It wasn't a POC thing. That was things that white people did. Okay, but we know that data is showing us something completely different now. And I just want to bring Phil in really quickly. He's got a sort of a comment to try and add to that. I want to get in there and get that question answered. Really, is what my question is. Phil, did you want to try and?
Mine was slightly off going off what was said earlier, but just I feel like when we think about sexual health or sexual health campaigns or resources, like a lot of it isn't sexy. Like we've removed like the sexual side of sexual health. So it's very clinical based, it's very medicine based, it's very risk based, prevention based. But like, when do you ever see like images of like kind of sexual acts that will grab people's attention and that will make, I guess, people interact with it differently?
I mean, I suppose where I come in at that point, so even though like I've got academic and professional experience in sexual health, I see myself primarily as an artist and storyteller, and representing sort of viewpoints around cruising and chemsex in a sort of kind of like through different artistic lenses that emphasize sort of pleasure, but also kind of look at some of the darker and kind of more some of the narratives that have grown up around the public health crisis around chemsex or cruising or HIV and barebacking, for example.
So we know that people don't always agree with sort of that concept, and I'm sure there's people in this space who will have a less of an understanding of what that means, and and how to even address that from a harm reduction perspective, from a risk management perspective. But again, coming back to the sex and the pleasure aspect, and really understanding how those things operate independently, I really want to try and understand how we can re-embrace that. And I think that Zaina might be able to give us a bit of insight into that, because you know, of the work that she does and sort of the passions that she has as well. So, you know, just to help us separate those two things a bit, and I do want to come back to the chemsex factor and sort of the things you're referring to, but I do want to just try and hone in on what Phil said by providing a bit of evidence from what Zaina might be able to add to that. So we didn't embrace sort of pleasure and sexuality, but then we brought it back. I've seen your campaigns, Phil, okay? We brought it back and tried to celebrate it, but then we're also trying to then separate ourselves from it again. Why is this ebbing and flowing? You know, what are we trying to, how can we get to the bottom of this?
Are you asking me?
Oh, no, I think Zaina's trying to unmute herself there.
Yeah.
Yeah, there you go.
Yeah, and then I saw Phil's lips moving.
Oh, that's okay.
Phil's trying to communicate through the medium of song.
So how can we try and embrace it? How can we eternally embrace that without trying to dissociate ourselves from it again and feeling the shame that we're taught to feel around pleasure within sexual health?
Yeah, when I first saw this question, I was kind of thinking about people from a diaspora, how we're denied the autonomy to find kind of a resonance of pleasure. And because we have this kind of stereotropic topography of our socialization and the societal narrative, that actually we're not deserving of pleasure. We're quite often, you know, what I was thinking about the previous question was this kind of medicalization of everything has long been a white-centered place. So we're not going to access places that we don't feel comfortable in. And, you know, we've long since been excluded from the fundamental principles of consent, even. And, you know, when we walk into places, we're surveying the landscape of, is this a safe place for us? Do we need to freeze, fight or fawn, you know, as a trauma response? It's not there's something inherently wrong in us. It's external. And most clients come to me with some amount of internal phobia of something that we don't always necessarily recognize, and something that can really help us to look at how we can get around that cognitive and emotional mapping and the biases is something called proxemics. And proxemics was an anthropological, there you go, who was called Edward Hall, and he thought about this science of personal space. And it came about because I speak at Poly Day every year, and I happened to say, what is it with people wanting to touch your hair? And everybody knew, and it was like, yeah. And I went away and I looked at it, and it's really poignant right now. It's how do we reclaim our ability to find our own pleasure, because it is buried under loads of different things. You know, lots of people come to me and they're not necessarily au fait with the love languages. And we could look at queering those love languages and including acts of solidarity and belief where we have mixed levels of privilege. I'm in an interracial relationship myself. And it's work that we've had to do as a couple, you know, acts of emotional labor, looking at types of attraction. It doesn't always have to be sexual. And I do a podcast and we talk about polyamory and consensual non-monogamy. And we say, well, it's kind of much more about Google Calendar than actually it is about sex. But we don't talk about it. Our parents don't like talking about it to us. We get all these messages from the media. So this is about, whether it's about relationship diversity, whether it's about showing yourself some self-compassion, you know, because self-care, you can fail at self-care. If you haven't got the cash to go on a spa day because you're working 2 jobs to make rent, you failed at self-care. You know, show yourself some self. I don't know whether Harvey's going to let me have the time to expand. I'll write it somewhere. You know, finding a place to be safe and vulnerable, knowing that vulnerable is a strength, not a weakness. Take away the stereotypes and the narratives around it, and finding that pleasure within ourselves. Because when we shut out one emotion, we shut them all out.
I think you get some really positive feedback, certainly in the chat, and I think people are, you know, the word heteronormativity is mentioned here, and I think that ties in perfectly to my next question to India, actually, and we're going to come back around the circle again, as you can imagine. But you know, India, you mainly work with sort of Black African groups or Roma groups, or who don't identify as LGBT. They're not queer individuals, but they still identify as POC. And I want to know, just in comparison and in contrast to what Dr. Baxter was saying, you know, I think you know, you can see how liberally, okay, how easily Dr. Baxter can sort of speak about his experiences, and you know, it's, you know, we should discuss this, and it's, you know, we can be open. Have you ever seen that in your spaces? And stating the obvious, can you give some insight into why that is, why that heteronormative sort of approach is almost like an advantage onto itself? You know, they don't have the additional barrier of the LGBT or the queer experience. What are you seeing in your day-to-day work, both generally, and if you can speak to sort of what Dr. Baxter said about chemsex and risk reduction as well?
Okay, so what we know from our communities often is that we have never been given that freedom to be sexually liberated or to just think of sexual pleasure as something that's for us. Often, you know, we've gone through such hardship in sexual health. We're blamed for a lot of the poor healthcare outcomes. So, for example, with HIV, we've often been told that, you know, Black people and Asian people are most likely to contract HIV, but that's where the conversation stops. And so for many generations after they've been brought up around, you know, we're always kind of blamed for these poor healthcare outcomes. So how can you feel confident, or how can you want to go and explore that further if you're being blamed for that? And if, you know, for example, I know a lot of Caribbean men are seen as being promiscuous, which I hate that word because no one else gets that title other than, you know, us Caribbeans. But in reality, I think often Black people are fetishized and it's very prominent. So when you see, you know, women are seen as sexy, we're seen as this, our men are seen as being lovely and desirable. But when it comes to our own sexual pleasure, where do we get space to explore that? Because when we go to sexual health services, we're no statistic. I'm another Black Caribbean, you know, who's got chlamydia for the second time. And it's that same narrative, you know, if we want to expand from things, then why can't sexual health services see us as being pleasurable? Why can't we experience that sexual freedom? And in relation to what Dr. Baxter was saying, I think it's great that, you know, a lot of people do have that sexual freedom, but when it comes to our Black and our Asian communities, we're so suppressed, whether it's due to culture, whether it's due to people's belief systems. And a lot of that is, you know, people have their own reservations on what they expect a Black person to be. And when we strip down what we are, I think first and foremost, we are people, and we all should be entitled to that sexual pleasure. But, you know, no one sees us as being people. We are Black people, we are, you know, queer Black people, and so on and so forth. So I think often the labels that we're attached with are seen as quite restrictive and quite damaging in our nature. Therefore, we can't have that freedom because everyone's thinking we've got chlamydia, we've got syphilis, we've got HIV. And in comparison to our, you know, men who fuck men, I think when you're white, it's great, you know, the world is your oyster. But when you're a person of colour, we aren't given that sexual liberation because we're not seen as being sexual, pleasurable people. You know, we can be someone who is, we're seen as sexy, we're seen as sex icons, but as an individual who wants to experience that sexual pleasure, it's not really, we're not there yet. And it's 2020, so I think it's something that we need to be asking our communities and ourselves about, how do we start to break down these barriers? And when you look throughout history, we've never had the time, really. You know, when you've been in a state of survival, when do you have the time to enjoy? If you're constantly, you know, 400 years is a very long time. So when do we start? I think the best time is now. So I think the best thing for this is just about people remembering that in order for us to enjoy such things, we have to be able to have the time to enjoy. And as we know, we often are faced with so many different outcomes, and people don't see us as people or as individuals. So how can we experience pleasure when no one talks to us about it? No one's explained to us what it is. And, you know, we've got culture, we've got religion, we've got other things as well. But first and foremost, we aren't seen as individuals.
I mean, there's a whole lot in there. Okay, there's a whole lot in there. But I do want to just go across to Dr. Bond and then go back across to Shireen again, and just try to understand, Shireen, just coming to you after Dr. Bond. I'm going to be asking sort of about sort of the crossover between we just finished celebrating RSE being released in schools. We're talking about young people. We're talking about relationship, sex education, and where the crossover and the link would be as you move into sort of the adult side of access to sexual health. Is there a gap? Are people being missed? But I just want to first go over across to Dr. Bond and just ask about specifically trans and non-binary individuals. Now, I need you to follow me here because there is this is being recorded. This is going to go on. It's going to go live. We're going to promote this, and I'm sure that someone will have an opinion about my question. And it's not on the question sheet that we prepared. But I need to understand the grouping of LGBTQIA how detrimental that can be to specifically non-binary and trans communities. Can you provide any insight around whether or not in your research, in your work, in your engagement with the community, that you feel that the pleasure narrative is being celebrated as much in trans and non-binary communities, or there are additionally barriers that are still presenting themselves that haven't even allowed people to start having conversations because they're just trying to stay alive?
Ooh, that is a very,
Sorry.
where do I begin with the question? So one of the things in my work and working with women, transgender women, and talking to them, really talking to them, is that no one is talking to them, and we are, especially in my field as being a health researcher and also people who do health promotion, is that we're throwing things at them. We're telling them what their narrative is. We're telling them what their issues are. And no one's even trying to understand what their experiences are, where they're going from, and what they really want. We have these narratives about everything that they're doing that is bad in their life, that is somehow negative. But you know what? That's not the case all the time. Sometimes we do have bad experiences, and sometimes we don't. And I say bad experiences is looking at the statistics and saying as if just because you're living with HIV or you're living with another STI doesn't mean that you cannot have sex or you cannot have pleasure when it comes to sex. Doesn't mean that you can't be in relationships either. Doesn't mean that every time you are intimate with somebody that it has to do with sex at all. And no one actually looks at them, and I've heard this before among other panelists, as individuals, and a lot of times under the umbrella the LGBTQ, and I'm missing the I, under that umbrella, they feel excluded a lot of times. They don't feel as supported or included. And so one of the things, especially, I really feel is important in the work that we do when it comes to sexual health is if we're saying that we are supposed to be providing support, and that's why I like to call it not just educating, but supporting people's sexual health, then we should talk to them. We should address this. Like, what can we do as clinical providers, healthcare providers? What can we do to support you in this way? Which it takes away the shame, it takes away the stigma, and then it's not, and put it on the providers, put it on the people who they're supposed to be receiving services for. They should not have to feel that they can't go to any type of clinic that provides to get a flu shot because if they in the waiting room, they're going to be discriminated against. That should not be the case. That's not their problem. That's the person who is discriminating against them problem. And that let them take that ownership. And then you need to create an environment. If you're providing services to the community, you need to create a clinical environment that is inclusive to everyone. And that's what my biggest thing is with I guess with engaging and talking with them is that, listen, they got the same problems that I have. And then they have other problems that are different, and they just want to be able to live. Really, everybody just want to be able to live and enjoy their life, have good sex if that's what they need to do at that time, and and just be healthy and whatever that may mean for them. So I guess I hope I'm answering some of it, but really I think that is the main thing that I in my work that I've talked to them about is like, who can I trust? And there's not a lot of places that they can go to that they can feel that they're safe and they feel that the individuals that they're working with are trusted.
So we're on about provision, we're on about representation, we're on about, I don't even want to say the word accommodating, but including people in our plans. Before we actually roll plans out, we're thinking about people, we're thinking about what they're needing. I want to go across to Shireen and ask just about the links between, young people who, as they become adults, we're talking about in schools or in who are accessing community centres in your area, and if there are any intentional links between the work that you do with young people, and the work that you've done with adults. Are there any clear and intentional links that are there in place to ensure that we're including people? I'm then going to go across to Zaina and ask about positive self-touch and proxemics. I want to go back to that. And then I want to go back to Dr. Baxter and ask about positive self-touch during the lockdown period. And I know Phil's going to jump on that, but I'm coming back to you, Phil. So just let's map it out that way, okay? So Shireen, over to you. Just understanding, are you intentional? As a practitioner, are you intentional? As a researcher, are you intentional as someone in the community in ensuring that the conversations, dumbed down though they might be, cover the same themes for young people so that they recognize the same themes as they get into adulthood and how we're recording that information? Or are we just going about it randomly? What do you do?
So in my previous position, I was actually trained in a curriculum called Positive Youth Development. And another program called the Teen Outreach Program. So part of that is actually looking at the whole person, which I think is a universal concept when it comes to health, sexual health, everything that you're doing. So for example, one of the programs I worked in was a teen pregnancy prevention program, but it didn't work in the way you might think a program like that would work. So for example, part of that program was community service opportunities, civic engagement. Part of that was learning life skills, really kind of building up the whole person. Yes, there was like a sex ed time or learning about things like masturbation or learning about self-care, but it was really from this approach of, well, we have to reduce the negative factors that are going to be detrimental to the person and increase the positive factors, increase those positive role models, and then hope that would affect those outcomes, not just saying, well, this is what you're gonna do, what you're not gonna do, and if you do this, you're a bad person, that kind of thing. So I think, just looking at someone, not just as their mind, their body, their spirit, looking at all of that, is something that's very important when talking to youth and adults. And, I would say that a lot of times the things you don't learn as a kid, you're going to repeat or bump into as an adult. So, some of us may have been sheltered or weren't allowed to explore ourselves, our bodies as kids. So now as an adult, we're seeing this for the first time, or we're actually getting a chance, to learn more about some of those things. Or, maybe we always knew who we were. We always, were able to talk about sexuality openly. But as an adult, the more you know yourself, maybe you go to therapy or whatever you're doing, you can only grow from there. And I think also, we're always students of life. So, we should always be exploring ourselves, exploring our partners, and just learning more and being more open. And I think that's a benefit of adulthood, is that you're aware of more resources and more support in those areas.
Oh, you would think we'd be aware of more resources. Sometimes we know less. We can only help people know.
Yeah.
And we know that during this lockdown period, and I'm trying to avoid the C word, the COVID word. I don't want to hear it. I don't want to think about it. Okay. But we know that this is what the situation is. This is why we're having a panel in the way we're having it. And during this time, we know that loads of campaigns were run across the world, all about self-touch, positive self-touch, how to enjoy on your own, how to enjoy on the camera, how to, not go crazy, because some people live in by themselves. They haven't got a balcony. They're saying, go out in the back garden. Back garden where? Okay. There's no back garden. What are you going to do? So, the concept of self-touch was a massive part of the recommendations during this time. And I just want to ask Zaina, just from your experience in maybe dealing with people's approach to the guilt factor of self-touch, or what they associate that or affiliate that with. What are you hearing? What were you advising? What should we be considering during this time? And then I'm going to go across to Patrick. I know you've got lots to say about that, and I'm definitely going to go across to Phil, because you've got a lot to say about that. Okay, so I'm going to let Zaina just take the mic there for a second. Okay.
So it's about this. It's been a mass mental health experiment that none of us were prepared for, and we really don't know what's going to come in store. I'm doing some writing at the moment about two-level subdrop and how it's going to be connected to the Kubler-Ross 5 nonlinear stages of grief, and we're going to be seeing this in mental health professions for
Oh,
years
break that down
to
for me.
come.
Break that down for me. Break that down for me. That's not my specialty. Please explain.
Have I got 60 seconds? Right, so yeah, so 2-level sub-drop, you have an initial hormonal drop immediately after scene, and following that a couple of days later, maybe even weeks later, you have the psychological drop. BDSM, which isn't bad, by the way, we get all these stereotypes that swinging's bad, BDSM is bad, CNM is bad, being queer is bad, and trying to kind of break through that usualization of sex and taking out those stereotypes, which are fed into all of us by osmosis. And so what we can do is we can link that second level psychological subdrop to Kubler-Ross's nonlinear 5 stages of grief. And therefore, BDSM is largely based on rituals, and so is our lives. And what I've been seeing from my clients, I've had this really unique view into lots of people's bedrooms, living rooms, bathrooms, cars over the last few months, is that people are missing the rituals. We're grieving for the rituals that we've lost this year. And so therefore we've had that hormonal drop where everybody went through the first 10 days when we were all locked down, and then we've adapted to it, and then we've come to peace with it. And now, could be next year, we're going to experience this second level psychological drop. So we're going to be dealing with a lot of grief from lack of rituals next year, which has absolutely nothing to do with the question I'm aware of.
But I was taking it in. I was taking it by osmosis. Yeah, but yes. But if you could just, what is the advice around that? What are things to consider? Where should our minds be going? I'm not necessarily asking for the solution, but yeah.
Yeah, absolutely. So it's this embodied trauma that we have and that we carry with us and that we get from other places. And quite often, one of the first things we do in therapy is we look at what's yours and we look at what was given to you from somewhere else and separate those out. Quite often people will present and they haven't masturbated. They don't know what an orgasm is. They don't touch themselves. And so it's very much about, I want you to do some sensate focus, which is an intervention that is quite often used. And I want to talk about porn with you because watching porn is a gateway into talking about sex and sexual experience. And there is so much shame that is put on us externally that means that we internalize that shame and we feel bad. This is about feeling good. This is about tapping into ourselves, because if we don't know what we like, we can't tell anybody else what we like. So we end up with mismatched sexual relationships that we feel that we need to put up with and we don't need to put up with. But that starts with knowing ourselves first.
So brilliant gateway into my next question to Dr. Baxter, because we had extensive debates, both sort of personally and professionally, around what message to put out. What message do we tell people during this time, with regards to their practices? One of the practices you referred to earlier on was sort of chemsex and sort of transgressive sexual health is what you mentioned earlier on. We talk about cruising, we talked about all these things. What did we do? What were we to advise people? What was the right answer to advise people during this time? We're thinking about the C word, we're thinking about lockdown, we're thinking about the guidance that the government has given us in all countries, okay? How were we to advise someone? Who were we to say anything different to what the government was saying, even with pleasure at the center of that advice? I don't know. What do you think?
It's a difficult thing, because I suppose if you're working organizationally, then you're getting funding from commissioners and whatnot, you have a responsibility to recommend the government's guidelines. And I think we've entered a period in history that has very judgmental and very heteronormative, a reinforcement of heteronormativity. If you have to have sex, have sex with somebody in your household. Well, it's not always going to be realistic, practical, or advisable for an awful lot of people. There was obviously this used for certain communities or queer men, for example. There's been huge restrictions on the types of sex that they're used to having. So cruising, saunas, for example, there's been a massive reduction in cruising. Chemsex, the conditions for chemsex to still happen during COVID weren't usually delimited in that, it's still something that happens in the private sphere. It's facilitated through dating apps, etc. But anecdotally speaking, I think it has kind of teetered off a little bit whilst still existing. I just want to address a few things, like when you said that, you know, like sort of chemsex and cruising, these are not things that that queer people of colour would identify with. Like, but if you actually go to those sort of spaces,
historically, it is believed that that is more seen in
believed or perceived to be so. Actually, in those spaces, they're more likely to have a broad range of ethnicities, people from socioeconomic backgrounds, age backgrounds, and body types. Than queer clubs or gay clubs or gay bars, which are usually quite exclusionary and which are usually quite cis-white as well.
Please dissect that.
So in terms of, it's interesting talking about rituals and sort of breaking with rituals, and how do you like, so part of, say, like cruising and sort of sauna for certain people will be like exhibitionism, like that's part of like the draw and attraction. How do you replace that during lockdown? So I think a lot of people have moved on to CAM in order to facilitate that particular sexual need.
What is CAM? What is CAM?
So like so camera sex, so like CAM forum and forums like that. Yeah, so I want to return something briefly to what Phil said about like how do we discuss you know, sort of transgressive sex and use imagery that speaks to that. And a lot of my work has kind of very sexually explicit images and language, that like prose that's very surreal and sort of kind of like, I suppose, esoteric and humorous. And I have been charged with sort of trivializing very serious subject matters, like you know, like chemsex as a public health concern. Well, A, why would I choose to trivialize my own experience? That would, I don't see that as a sensible thing to do. And B, why do we have to always look at these issues through this sort of dour, heavy-handed kind of health and professional focused lens? And there are other ways and means in which to express and to represent this. And always in my work as well, you know, the narrative, the public health crisis narrative around cruising or barebacking or chemsex, or there's also been this sort of queer liberationist narrative which says that, you know, chemsex, for example, is all about, you know, queer people consciously and politically challenging heteronormativity. I don't quite buy into that either. I mean, what I would say is that all of these are narratives, that they're all stories. And I'm quite explicit when I write about chemsex, for example, saying this is a chemsex story, not the chemsex story. So I think where I come from it is I'm a storyteller. So I'm just finding different ways to talk about these sort of experiences and to kind of play with people's perceptions of them a little bit and use sort of artistic devices to do so. And I've done that recently with a piece on cruising. And it has been a traumatic time for a lot of people, and a lot of people have found the sort of sexual pleasure that they were used to engage in pre-pandemic, in the before times, has been massively restricted, and trying to find other ways to replace that. It's a difficult thing, you know, the notion of masturbation. Well, for somebody who, for instance, you know, is used to like sexualized drug use, you know, having a sober wank is usually underwhelming experience.
Well, you know, I'm glad you said that statement there, because you know, controversial yet again, I'm going to say it. This is where it gets complicated. When we start advising people, you know, within the community, people might come into our services. They might be friends, they might be acquaintances. People have pointed them toward us for advice on that. You know, when I scroll down my social media, I see things from Team Prepster, and they developed this new branding, you know, about, you know, what is the tagline? So it's like how to have sex during lockdown. Is that?
It's something like what to do when you're horny.
Yeah, what's doing your horny. And the images are very, very explicit. Okay, they're very, you know, here's the image. This is what you're getting. And there becomes this level of saying, well, if you're going to do that, if you're going to engage in chemsex, if you're going to, you know, if you're going to engage in whatever is being promoted there, there's like consequences, or there's some type of, you know, the outcomes are up to the individual. And, you know, then the conversation becomes about putting the responsibility on individuals. If they want to engage in these things, then they must, you know, take the responsibility, whatever that feels like. So what I'm referring to is the last statement you said is when there is no sort of chemsex aspect of that experience, and then you go back to just regular you know, positive self-touch or regular, as you would say, sex, how down that can feel in comparison. And so in protecting your pleasure experience, how do you protect how does one protect their pleasure experience? And I want to ask Phil, how are you encouraging people to protect their pleasure experience by not, you know, maybe putting themselves at the risk of losing that by having really, as you mentioned, Dr. Baxter, really esoteric experiences that are not, you know, the average? I hope that makes sense. I hope I'm not offending anyone, or I'm not, you know, sort of diminishing anyone's experience, but I think it's an important question. I'm then going to come across to India and Shireen to ask about faith community.
It's a lot of easy questions today. So like, I think I kind of understand, or like we at Prepster kind of understood that it's advisable not to have sex, and that's what the government was advising. But at the end of the day, people are gonna have sex, whether you like it or not. I mean, if people weren't gonna have sex, then no one would exist. Do you know what I mean? Or like from times where, in previous times where it was advisable not to have sex, people have had sex, you know? So I think instead of like doing this whole thing of what you should do is just have a wank, or just do a wanking pledge, which is, I think our organization was one of the only ones that was actually saying, you probably shouldn't have sex, but if you do have sex, these are the safest ways you can do it. And I think like that's kind of the narrative that everyone should have done, because it's not that people, I swear after like 5 months of the C words, then it became acceptable for sexual health organizations to say, oh, actually it's okay to have sex now because bars and restaurants are opening up. And it's like, so you just assume that people are not going to have sex for 5 months. Like some people are lonely, some people have poor mental health. Some people use sex as a coping mechanism. Like it's not possible for each and every single individual to not have sex solely because the government has said not to. So the information that we provided is just from some research that has been done, and just some things that we came up with, which will be some of the safest ways you can have sex if you choose to do so. And I think there needed to be more of that, and it still does, but it's really tricky with how things are in the country right now.
Brilliant. That's a brilliant response to that. Thank you so much, Phil. I do want to venture to the you know, a bit of a different topic here, and just ask. Oh, go on, Dr. Bond, if you want to jump in there.
No, I saw someone said that the New York Health Department had a really great response to the pandemic, and we did it. We didn't. And I'm from New York, so I got to say it like that. They didn't put out anything that they were like, listen, if you're gonna have sex, and they included masturbation. They was like, listen, get to know yourself at this time, you know, and you know, do other things with somebody that you feel is a trusted person. Meaning that if you're going to engage in phone sex and engage in cam sex, whatever it may be, and then if you do have somebody that you are having sex with, check, or as a new person, check to see how they're social distancing, like what are they doing, and make sure that their response to the C word is equal to yours, and then engage in it in that way. So I think that's important for people to understand, like, listen, let's be realistic about it. People are going to have sex. We want to have sex. We enjoy sex, but how can we do it in a way to minimize our vulnerability to something else?
Absolutely, and I think, you know, one of the things that is an existing theme even prior to any of this happening, meaning lockdown, is the secrecy factor in how people had to move away from, you know, being able to conduct relationships or have relations or have sexual intercourse in all of its forms in homes where they share space. You know, that might be with their parents, it might be with you know, a housemate, a roommate, a flatmate. It's just not possible, and so that's where sort of cruising came about. You know, people trying to do maybe do it in secret, you know, do it in a public place, and of course that sort of picked up its own trend. I'm not a historian around that, but you know, it is a factor that, you know, we have to consider, really, that particularly in communities of color, that, you know, the secrecy factor of having to find a place to have it. You know, if, you know, back in my online dating days, you know, it was a really big deal to you know, to find out who could accommodate. You know, I remember that being so frustrating, to be like, who can accommodate? You know, can you accommodate? I hated that, because it was, you know, it was a reality that if you were living in joint housing, you couldn't accommodate, could you? Phil is laughing, he knows it's true. And so people would find other ways. They have it in cars, they do it, you know, behind bushes, you know, in places that they probably shouldn't, but it's equally fun. Just going to put that out there. I just want to come across to, yeah, so I said that in response to what Dr. Bond said, wondering just sort of for communities that don't have that support at home, you know, the added barrier. I just want to just acknowledge the added barrier of trying to just engage in that pleasure experience. Even as a non-binary or trans or otherwise marginalized community within, you know, multiple intersectionalities. Zaina, I see your hand. I do want to ask India just about her experiences with queer faith communities, if you've had any experience with that. And I'm going to pop over to Shreen. I'm going to pop right back to you, Zaina, if that's all right. You know, is there any room for conversations like these in queer faith communities? I know that in your work, India, you know, you do deal with, you know, quite a high percentage of queer, faith communities, people from faith communities who access sexual health, and that's sort of, you know, the bread and butter of BHA there. Is there room? Is there room for pleasure, or is it just about sex? How are we selling this to these people?
Yes. So, because we work with people from all religions and spiritualities, so one thing that we do really say to people is that actually, when it comes to pleasure, it's about you and your enjoyment, and it's about unlocking that higher power within yourself. So how can you expect your partner to know about you if you're not comfortable with yourself, or you haven't found that inner self within yourself? So there's definitely space within the community for it. But when it comes to religion, I think often we get caught up in other people's own biases or their own opinions. When you really strip it back down to basics, you know, in the Quran, you talk about, you know, paradise at the foot of the woman, or at the foot of the mother, sorry. So interpret it how you will. And we also know that Prophet Muhammad, you know, stopped his journey to go back and to speak to a man who wasn't pleasing his wife. He said, look, you have to please your wife, because this is how you create that soul ties, how you bond with your partner. So when we come back to pleasure and faith communities, often it's down to people's own biases and prejudices. When you really go back to these spiritual books, these guidances, this is about how we find that connection, that closer to the higher power. And pleasure is a key, it's the gate to that. So by knowing yourself and by pleasuring yourself, then you can strengthen that connection with that higher power, and you can also start to understand yourself.
I'm just trying to imagine you wording this. You know, a person comes into BHA, they're seeking advice, and this is the conversation. I mean, I want to understand how that is received, and if there's, you know, if there's a certain way you present that, and then Shreen, I'm going to come across to you and ask you, you know, in your experience as well, just as a personal experience. So just get ready, okay?
So often, I think the beauty of BHA is that when we go out into the community, we'll see the same people. So often I'm seeing this person, I know him, it's Bob, you know, he's from my side. And so often the first conversation is, pleasure, I pleasure my missus all the time. And I'm like, do you really? Do you really? How do you know you're pleasuring her? He's like, well, you know, once I've nutted, that's it. I'm like, yeah, but was that just a response? You know, because as we know, that is just our body's responding to a certain reaction. Have you really enjoyed that? And how do you know you enjoyed that? And so we often just kind of ask people is, what is your interpretation of pleasure? And how are you going to communicate with your partner? Do you have the communication skills to say that? And often I get these looks as if to say, girl, please. But then again, it's like, you know, when I see that person again, I'm saying, well, did you have that conversation? And they're like, oh yeah, I did, you know, and my missus wants me to kind of talk to her first. And then we get into the bedroom, whereas usually I just drag her upstairs in the healthy way. But, you know, often it's about people just think about sex as being reproduction. And it's like, no, there's so much more to that. So once you start talking to that person about what are their needs, you can then apply it to their partners, or, you know, or so how do they define pleasure?
Brilliant. Thank you so much for that, India. Just 1 minute for Shireen, then over to Zaina, then I'm going to pop back to just calls to action there, if you don't mind. So Shireen, I just want to understand from a personal perspective, you know, I know that, you know, my dad was a pastor. I'm going to put that right out there. When my parents found that I was going into sexual health and I was going to do it all the way to doctorate level, that I was that invested in understanding sexual health, there was a lot of silence in the room. What was the response from those in your community, from whether family, friends, that you chose sexual health as a way you're going to invest your education and you're going to invest your commitment to improving the well-being of other people? With your background, it wasn't on the sheet. I'm just asking you.
Well, I guess I can even tell on myself too, because this is not something that I even chose for myself initially. So I even at one point was like, well, I don't think I can do that. But, you know, it's like God always has a sense of humor if you believe in God, you know. So now with the work that we're doing, it's like, you know, I'm packing condom packs, you know, I can talk about female condoms, I can talk about lubricant, and, you know, like if someone wants to come to my house right now, there's like a big black trash bag full of condoms, like those kind of discuss, like, yeah, I have that. Like on my Instagram one time, I showed a female condom, and people are like, ooh, what's that? What's going on? You know, and I'm like, I can demonstrate it if you want, you know, and some of the guys are like, oh, what's that? What's going on there? Other people are like, I've never seen this, you know, so there's that comfort level or discomfort level that comes along with it. And I think, you have those stereotypes, like if you promote sexual health or things like that, you're promoting having sex with anyone, or you're promoting living life on the loose side, or, you know, you don't care about yourself because you're just saying, well, I need to store condoms so that I can always be ready to have sex. But there's another side to it, which just means you're taking care of yourself. So I haven't received too much pushback, but you can definitely tell how much exposure someone has had to these topics based on the surprise they get, and, you know, the kind of the intrigue, or they're like, oh, that couldn't be me, you know. So
I mean, I ask that because, you know, oftentimes we focus on the community, but what about those delivering it? There's a lot of for us bias. You know, you're delivering it because you're a person of color to people of color, or you might be a queer person of color delivering to queer people of color, or you might be a queer person delivering it to queer people, you know, and we forget about how we're feeling. You know, what are we going through to be able to get to the point where we can actually have conversations, have them comfortably, and make people feel good about these conversations. So just going to pop over to Zaina now. I think you've got a comment in the chat from Jess or Zaina that you might want to address there in regards to it's scrolled right down now.
Oh, have I? Has it disappeared?
But if not, you can just say what you're going to say. I think it's talking about Western versions of Tantra.
Right. Yeah. So that kind of, and working with energy is really, really good. And for those clients that's the thing they do, then that's the thing they do. And this is about moving energy around the body. Obviously, I'm a hypnopsychotherapist, so we can move breath around the body and energy around the body and really connect with our pleasure centers. What I wanted to just say quickly is this: concealment of identity is the largest cause of psychological distress. And lately, you know, some people have been stuck, not only being prevented from accessing pleasure, but have been forced to hide their whole identity. And it's been really, really difficult for everybody.
Wow. Ouch. Okay, yeah. Okay, we're talking about generational trauma. We talk about, you know, suppression and what that can do to us and our performance ability as well. I'm looking at the time, we've got 2 minutes, and I just want to ask if there's any, you know, what are the takeaways? So we've had a lot of discussions. We've tried to cram quite a lot into this space. I recognize that people's capacity wise, you know, I didn't want to go beyond an hour to sort of encourage people to tune in, but not to feel burdened by what we've discussed today. What are the call to actions, if anything? I just want to ask 15, 20 seconds per person, if you could just let us know what the take-home message might be from what you brought to the table today.
Mine would just be to make sexual health sexy.
Okay. Shireen, did you want to go ahead?
Oh,
And then
I was going to piggyback off what he was saying a little bit. What I thought about earlier was definitely, you know, including the population that you're trying to reach. And I think knowing, you know, what's attracted to the population, being, you know, sexual health being sexy, that's going to be important. You know, if you have a campaign and you want to increase uptake of PrEP amongst Black women, you have to target it a certain way. And there's a reason you do what you do. So
so be intentional. Absolutely. Okay, Dr. Bond, were you going to say something there?
Yes. My thing is that what I actually use when I talk to young people is C plus C equals pleasure. And so that is consent and communication equals pleasure. And to be more, so that we are not just, a lot of times when we talk about sex education, we are so uber focused on so, you know, the sexual identity or the sexual orientation, and doing that, we are excluding people instead of being inclusive and understanding that everyone has sex in different ways. And so I think it's more important to focus on consent and communication, really, and leading to pleasure.
Amazing, amazing. All agree. Dr. Baxter, 15, 20 seconds.
15, 20 seconds, well, I don't know how to wrap up in 15, 20 seconds. It was in terms of just looking at pleasure instead of risk all the time. I think somebody mentioned it's very easy for me to be like very free and liberated talking about chemsex, and it isn't actually, because I'm one of the few people working in the field that's open about that, because of the amount of stigma and pathologization that exists around certain sexual practices. So I think a process of collectively being more open in our conversations about our participation in the types of sex that we enjoy having, whether that's normative sex or not, can lead to a discourse that will break down stigma and will depathologize. Yeah, that's, I think.
That was pretty good, Dr. Baxter. I think you did quite well in keeping that quite short. That was good. Zaina, takeaway message. What's that one thing that you want people to take away from what you said today?
Yeah, so I want people to acknowledge that pleasure can come from anywhere. And in the words of Disney, pleasure is a friend, not foe.
Nice. I like that. Okay. India, takeaway message.
Well, mine's just give power back to the people. You know, we know what is best for us, and just by providing us with knowledge, that's how we can start to break down these barriers. If we don't know, we never will.
Have you guys practiced these? It's amazing. It's amazing. This is a bit suspicious. Okay. That was amazing. Have I gone around the circle? Have I gotten anyone? Shireen, did you say you won?
I did.
Okay, right, okay. Okay, want to make sure, okay. Well, this has certainly been a really rich discussion. It's certainly been very insightful. I think I've taken something away from this, and that's when I know it's been successful, because I know that me, as someone who is a practitioner as well, and that people come to for advice and for guidance, and when I take away something from these spaces, I know that that's been worth everyone's time. And so I'll just use that as an indicator. And I really want to thank my guests for joining us this evening, and being so flexible and contributing what they could. I'm sensing a part 2 coming on. Just watch this space. I feel like there's more to talk about here. We might try and break it down into 2 subsections, but I definitely think that this has been very valuable, and I trust that our listeners and those who've been in attendance would say the same. Lots of positive feedback in the chats, and we hope to sort of grab some of these links here as well. So there were some links that were shared just about some of the work that Dr. Bond, and also I think someone in the chat mentioned, I think it'd be interesting to look at that, how the government made some recommendations in New York City around what to do during this time, because we're in the middle of it and it's not going anywhere anytime soon. So we might as well get a plan of action in order. So thank you so much for your time, and I hope you all have a wonderful evening and wonderful day for those in other time zones, and we'll speak soon. Thank you so much.
Yeah.